Welcome back, class. It's Dr. Linder. We are still talking about connective tissue, and now we're going to focus on just one interesting component about connective tissue, and that is the ECM, the extracellular matrix. And in terms of health and wellness, having a good, healthy extracellular matrix means that you are a healthy, functional, musculoskeletal system. Okay, when it's healthy, there's no joint problems, there's no cartilage problems, there's no ligament, there's no tendon, there's no joint issues. But when there's issues with it, you're going to have pain and degeneration and decreased function. Okay, so here it says that the ECM they're the ties that bind us together. That the healthy ECM means reduced pain, reduced degeneration, and good, healthy function. An unhealthy ECM, where do we see an unhealthy extracellular matrix? Well, we see it in people who suffer from soft tissue injuries. We see it in people who have routine injuries, meaning repetitive injuries. They keep spraining the same ankle. They keep hurting the same shoulder. They keep injuring their lower back. People with poor posture that have difficulty in maintaining healthy and proper alignment. Because when you don't have good, healthy alignment, ligaments are stretching, tendons and muscles, they're all stretching. The soft tissue structures stretch beyond their normal anatomical limits. And when this happens, people start to experience degradation. When you degrade connective tissue, it means you break them down. And in order to break them down, since we have connective tissue that's made up of collagen and protein, when we see collagenase or proteinase that's being released, anything with an ACE is an enzyme, it's going to degrade and break down these tissues. So when someone has some sort of injury, not acutely, not just saying they sprain their ankle and it's sore for about 7, 8 days or 2 weeks, that's okay. It's when it doesn't heal properly and it's chronically inflamed, when a patient has a right hip problem or a right shoulder problem, and when you ask them how long has it been hurting and been sensitive, when did this injury begin, you don't want to hear answers like 5 years ago, 10 years ago, because that means that they have these collagenases and proteinases in circulation, and it's going to break down all the collagen and break down the protein. It's going to degrade and get worse and worse and worse. So the goal is to try and down regulate, right? Turn down the volume or down regulate the expression of these collagen damaging enzymes. And the collagen damaging enzymes are called MMPs, matrix metalloproteinases. You don't have to write it down. It's going to come up, the spelling of it, in about a slide or two. So we want to down regulate or turn down the expression of these collagen damaging and protein damaging enzymes that are called MMPs to support balanced healing of the extracellular matrix tissues. So where do we have extracellular matrix? Well, we're going to have them in tendons. We're going to have them in our joints, our ligaments, our cartilage, and our fascia. So if we have extracellular matrix in all of these structures, when you have MMPs in circulation, they can degrade and damage all of these things, not with acute inflammation, but with chronic inflammation. Anything over 4 or 5 months is going to damage and break these things down. So the extracellular matrix, that's the scaffolding for the cells. and it's a defining feature of connective tissue. And we know that it's made up of heparin sulfate, chondroitin sulfate, high hyaluronic acid. We got collagen fibers, we got elastin fibers, we got fibroblasts, we got chondrocytes, osteoblasts. We went through all of these in a separate slide. Now, this matrix is this web, right? It's a web of connective tissue, and it's going to provide adhesion to the cells. It's the glue that's going to hold everything together. It's the scaffolding. All right. And it participates in the signaling, in intracellular signaling, the communication among cells in those tissues. And it's involved in translating the mechanical loading or the mechanical stress throughout those tissues. Now, let me just move this out of the way so I can see this a little bit better. Now, the ECM, that extracellular matrix, ECM, the extracellular matrix, these are going to break down or degrade after an injury. So what happens after an injury? Well, within the body, we have prostaglandins and thromboxanes, and these are created for the purpose of signaling pain. And when you feel pain, that's going to induce inflammation. Not a bad thing. Inflammation is the first sign of healing. Inflammation is the first sign of healing. And it has different characteristics, inflammation. We know that when something is swollen, it's inflamed. When something is hotter, it's inflamed. When something is red, it's inflamed. So all of those are signs of inflammation. But in order to heal, we need inflammation. It's not a bad thing. It has a negative connotation. Oh, that area looks inflamed. Oh, it's infected because it's red. It's inflamed. Well, how else is it going to heal if it's not inflamed? Okay. Now, the chondrocytes in the extracellular matrix release MMPs. What are the MMPs? Matrix metalloproteinase. And there's the word proteinase. It ends in ase, which is an enzyme. It's going to break down proteins. Sometimes you see the word collagenase. Well, collagenase is just a type of protein enzyme. So MMPs, matrix metalloproteinases, can degrade any type of protein, collagen, elastin, basement membranes. Anywhere you got protein and collagen, it can break it down. So is there a way of down regulating and turning down the expression of some of these MMPs? The one that's been probably the most researched are MMP1 and MMP13. These are collagenolytic. Lytic means to break down. It's going to break down collagen. So MMP1 and MMP13 are collagenolytic MMPs, and they're the mostly associated with cartilage breakdown, with cartilage collageноlysis. So what does that mean? When you break down cartilage, we're thinking degenerative joint disease or osteoarthritis. Okay? Chondrocytes are stimulated to secrete elevated levels of MMPs that once they're activated, they mediate proteolysis, breakdown of protein in tendons, bones, and cartilage. So the longer you have inflammation in a chronic state, you can break down the protein in tendon, bone, and cartilage. And what started out as just an ankle sprain, all of a sudden that chronic inflammation that was never down regulated, all of a sudden the person's just walking and then they tear the Achilles tendon, or they're walking and they fracture the fifth metatarsal of the foot. Okay. And these stories happen like this all the time. So here we're looking at a chondrocyte, and you could see we got MMPs. They make them look like these old school Pac-Men. And then over here, you got collagen. So what do MMPs do? The MMPs are going to degrade and break down collagen. So any part of the body that's got collagen in it is going to be degraded. And we know that bones can be degraded. When that happens, you have osteopenia or osteoporosis. You have collagen in your blood vessels. So blood vessels can become weak. Strokes, TIA, heart attacks, tendons and ligaments can tear, myopathies and tendinopathies. Teeth can break down, right? You can get gum disease, tooth decay. It all breaks down. This is a sign of unhealthy individual. So the goal is to try and turn down the volume and the expression of those MMPs so that they're not in circulation for an extended period of time. Because if they are, your tendons get damaged, your bones are going to fracture. It's not easily to repair from wounds. You get multiple degenerated discs and you get periodontal disease. All of these are a sign of clinical conditions that have increased expression of those MMPs in circulation. It means that the person is chronically inflamed, but people just look at it as, oh, I've got teeth issues. Oh, I have a herniated disc. Oh, that wound is not healing properly. I don't know why I get these fractures in my foot. I don't know why I keep damaging my tendons and get these strains and sprains all the time. It's chronic inflammation. That's bad. Acute is good. Acute inflammation is good. When you get a cut, when you get an insect bite, you want acute inflammation. You want it to heal. But when it stays with all these inflammatory mediators around for months and even years, very, very, very bad. So in healthcare, there's different ways to try and mediate and downregulate the inflammation and the degeneration. So they try and find matrix metalloproteinase inhibitors, right, to try and mediate and stop the degradation of the extracellular matrix. And there are some things. There are some things that we use. There's some bitter herbs like hops and berberine. These modulate MMP13. Hops is what's in beer. And that's why people tend to feel better and less pain and inflammation after drinking a nice dark beer because the hops. I don't mean drinking a whole keg and getting sloshed. We're talking about just respectfully one beer. Berberine is another very powerful herb that's researched pretty heavily these days. Really modulates MMP13. Selenium is a mineral that's used to modulate MMP1 and MMP2. And B9, B9, which is historically known as folic acid, can affect MMP9s. We start to see MMP9s, especially after COVID and all the vaccines and the jabs, the boosters and all, we tend to see high amounts of MMP9s, which can damage your blood vessels. So MMP9s are known to cause strokes and TIAs and cardiovascular issues, and folic acid is known as an MMP9 mediator. Okay, it can downregulate that. Okay, when I come back, we'll talk about some of the connective tissue fibers.